Imagine lying on an operating table. No anesthesia, no morphine, no antiseptics, no sterilized tools. The surgeon lifts a saw. You are fully conscious, and yet you feel no pain, no screaming, no shock, no death. And when the surgery ends, you survive, not just you. Hundreds of others. This is not science fiction. This is not a myth. This actually happened. Between 1843 and 1846, a Scottish doctor named James Esdaile performed over 400 major surgeries, amputations, tumor removals, eye, ear, and throat operations, all under mental anesthesia alone. And the strangest part? His mortality rate was only 2 to 3%, far lower than most European hospitals after anesthesia was invented. So what was really happening? Was it the power of the subconscious mind? Or is there something deeper, something medicine still doesn't fully understand? To understand why this story is so disturbing, you need to understand the time period. The mid-1800s were a medical nightmare. Surgeries were brutal. Patients were strapped down. Screams echoed through hospitals. Speed mattered more than precision. Doctors believed pain was unavoidable. Worse still, infection was misunderstood. This was before germ theory, antiseptic surgery, and sterilized instruments, gloves and antibiotics. Hospitals were some of the deadliest places on earth. In some European surgical wards, mortality rates reached 40–60%. Then came James Esdaile. James Esdaile was a Scottish physician working in British-controlled India. He noticed something strange. Patients who entered a deep mesmeric trance, what we now call hypnosis, reacted differently to pain. So Esdaile did something unthinkable. He performed surgery while patients were hypnotized. No ether, no chloroform, no drugs, only mental suggestion. And it worked. Patients remained calm. They did not scream. Some later reported feeling pressure, but no pain. But Esdaile didn't stop there. He went further. Esdaile didn't just hypnotize patients to block pain. He also gave them a suggestion that no infection would develop, that no sepsis would occur, that the wound would heal cleanly. Remember, this was before bacteria were known. And yet post-operative infections were incredibly rare. No pus, no gangrene, no blood poisoning. Even more shocking, no patients died during surgery. In an era where surgery was often a death sentence, Esdaile's hypnotized patients survived. Some researchers believe the answer lies in the subconscious mind. The subconscious controls immune responses, stress hormones, blood pressure, inflammation, and pain perception. Under hypnosis, the brain can suppress pain signals, reduce stress-induced shock, lower cortisol levels, and improve immune efficiency. Pain weakens the body. Fear shuts down healing. By removing fear and pain, Esdaile may have created the perfect environment for survival. Modern science confirms that stress suppresses immunity. Fear increases inflammation. Trauma delays healing. Anxiety weakens resistance to infection. Hypnotized patients were calm, relaxed, emotionally detached from trauma. Could belief itself alter biological reality? Placebo effects can reduce pain, lower blood pressure, trigger dopamine release, and affect immune markers. But these surgeries went far beyond placebo. Limbs removed, tumors cut out, flesh exposed, and still no infection. Esdaile's work was dismissed and ignored. His results threatened the foundation of medicine. They suggested pain isn't mandatory, infection isn't inevitable, and the mind may rival drugs. When anesthesia arrived, ether and chloroform, the medical world moved on. His ideas were quietly buried. So what really happened in those operating rooms? Was it hypnosis, suggestion, reduced stress, or something science still doesn't understand? We still don't fully understand consciousness, pain, healing, or the mind-body connection. Maybe Esdaile touched something far ahead of his time. If the human mind can block pain during surgery, if belief can influence healing, then the most powerful medicine might not be in a pill, it might be inside you. This is QuestionSphere. Questions that spark the mind. If this story disturbed you, intrigued you, or made you rethink reality, you're exactly where you need to be. If you felt intrigued by this one, hit like, tap subscribe to QuestionSphere and share this video. Drop a comment with the next question you want QuestionSphere to answer. Till next time.